So the use of stem cell therapy and canine and feline medicine is just continuing to explode, and it all began with human and equine medicine years and years ago. We found the data and the outcomes to be so successful with some of the conditions we were seeing in equine and humans that we thought maybe we should start looking at this for small animal practice. Applications being osteoarthritis, for example, limitations, especially with some of our patients with medications where they may have an intolerance to nonsteroidals, whether it be issues with their liver or their kidneys or their GI tract. This is something where we can actually take stem cells, process them, and inject them directly into a joint. The important thing to realize, though, is we're not regenerating that joint. For the osteoarthritic patient, we're improving their pain management, we're decreasing the inflammation within the joint, and we're doing this through holistic conservative means. So when this product wears off months and months and months or years later, we will go ahead and repeat that dosing scheme, but still with the benefit and not having the side effects that we see with so many of our oral products. For a soft tissue injury, this is where we have tendon or ligament injury. Some of these injuries don't require surgery. These are injuries that are maybe a grade 1 to 2 sprain or strain, and we know if we do nothing, they'll form scar tissue, they'll continue to wax and wane, they may further break down. So the area of regenerative medicine, meaning stem cell therapy, is fantastic for these types of injuries because we can identify them on such things as musculoskeletal ultrasound, process our stem cells, and then inject them under ultrasound guidance into those areas, ligament and tendon injuries, and try to get them to heal with more natural means as far as replacing the tendon tissue or ligament tissue or turning into that type of tissue to the best of its capability while decreasing the amount of scar tissue and allowing for better function. So the average practice should absolutely and can absolutely be getting into the area of regenerative medicine and in particular stem cell therapy. For most of us as veterinarians, we're pretty comfortable collecting a small fat sample. For me, I'll just go into the falciform ligament, the linea, make a little incision, take out your falciform. Now what do we do with that little bit of fat? We can take it into our own lab in our own hospital, and there's many countertop systems that are available nowadays that you can train your doctors or your technicians to process that sample, and that will extract as many adipose-derived, what we call mesenchymal cells or progenitor cells or stem cells, that then we inject back into a joint or a ligament or a tendon for some sort of disease process. Or we can collect a small amount of bone marrow. So we can take that needle, put it into the humerus, into the femur, collect bone marrow. Once again, go to our countertop systems. The one we use in particular, VOSM, is a centrifuge system that will then extract the adult stem cells, the bone marrow stem cells, separate those out, and then inject into the various locations that have disease or injury. So very, very feasible. If you don't want to get into the processing yourself in your own hospital, you can take that same bone marrow sample or fat sample, send it off to a lab. There's many labs around the country, many companies and universities even, that will take that final sample, process it for you, and within days to weeks, ship it back, and then you do your injections. So if you would like the idea of the technology for your patients but don't want the mess of doing it in your own hospital, collect your tissue sample, send it out, and wait for it to come back. If you're like, yeah, you know what, I wouldn't mind doing this in my own hospital, I think we're set up and we're ready to dive into this full stream, go ahead, collect your tissue sample, learn how to do the processing in-house, and then you can do your injections all at the same time.